This is MSU Today. Here's Russ White.
MSU Healthcare Imaging Services is an integral part of MSU Healthcare. The imaging services clinics have served the Mid-Michigan community since 1975. The dedicated team of healthcare professionals has pioneered research and clinical applications in radiology and established a world-class reputation for excellence in quality patient care and academic achievement. They're getting a new location at the McLaren Greater Lansing Hospital.
My name is Colleen Hoffman. I'm the radiology administrator for MSU Healthcare Imaging Services.
Holly Peterson. I am the assistant radiology administrator.
We oversee the day-to-day operations within the imaging services department. We've sort of split up the modalities. I'm in charge of PET, CT, and MRI.
And I'm in charge of ultrasound, mammography, and general x-ray.
So talk about a typical day or what you do there. What do you want prospective patients to know or the general community to know about? Before we even talk about moving or new stuff, just what goes on there? Well, it might seem obvious, but
No, it's not obvious to some people because my neighbor didn't even know that they could come to MSU for healthcare. MSU Healthcare has been around for years. The radiology department itself has been around since mid-1980s. It was started by Dr. James Pochin. We provide outpatient imaging in the modalities that we listed for patients, for the community. We serve the community. We try to be patient-centric. We try to meet the needs of our patients while addressing the needs of our referring physicians within our own MSU Healthcare and outside the community.
Yeah, I think people believe that it's just for MSU employees or retirees or students. And although we do take care of those people as well, it is for the entire community.
And what do you mean by patient-centric? I think people would just assume every place is, but not necessarily.
I don't think
what
so.
Do you mean?
We try to be extremely patient-centric. We try to provide appointment times that are flexible. We, in MRI, we start at 6:15 in the morning and we run till 10:30 at night so people can come before work or after work. Most outpatient doctor offices are only open 8 to 5. We have expanded hours to help meet patient needs. We run on the weekends to help patients get in a timely fashion without having to impact their life.
Tell me about the new facility. What are you going to be able to do that you haven't been able to do before?
Well, we are joining in this great joint venture with McLaren, bringing, I say, the best of both worlds together, taking what we believe is good patient quality and patient care and what they do and being able to bring it together, which will be great. A brand new facility, all brand new equipment.
I think that we're bringing the best of both of us to be exemplary for the community and for our patients. I
kind of like to say like a full circle women's imaging and breast care. We do screening mammograms. We do, follow-up diagnostic ultrasounds. We do biopsies, ultrasound biopsies, stereo biopsies. And then if an unfortunate situation is where a woman does have cancer or a gentleman, McLaren, we're able to continue care right there in one facility.
Right. They don't have to go outside the community. We're trying to keep everything and the access within the community for the patients of our community and to draw those in from the outside of the community.
So located at this new McLaren Hospital that's opening shortly?
That's opening.
We're going to be going live February 28th with our imaging. The hospital proper is going live on March 6th. So they're kind of doing a staged approach so that we're not all new the first day at the same time. And by moving us early because we're outpatient based, we will be located in what's called the Outpatient Care Center, which is on the north side of the hospital. So we're connected, but we're sort of outside. It's got very convenient parking. You don't have to be in the hospital. And I have to say, McLaren has done a phenomenal job on the interior with their colors.
And just everything to offer.
It's
there's
stunning.
A coffee shop there. There's going to be a Walgreens there. There's going to be lots of added features that patients can enjoy. Or if you're with if you're bringing a family member and you have to spend the day there, there's going to be lots of things for you to be able to do and be comfortable while you're there.
They have private seating areas.
Yep.
They have open seating areas. It's phenomenal what they've done.
Yeah.
state of the art and
It is.
brand new technology.
It kind of reminds me of a movie set. I mean, it's that pretty.
Yeah. No, definitely state of the art. And it's just nice with everything new. Our machines, like I said, they're all brand new. They are the latest and greatest, and we're excited about that. We do want people to know, though, that it's going to be the same staff. You know, we have patients that we have seen for years that want to see that familiar face, and that familiar face will be there. The staff will be there for both, for MSU and McLaren. You know, I know a lot of people do like, we're currently in the IDE building. It is easy access, easy parking, and they're going to have that same easiness when they go.
They'll be able to recognize faces. Even though we are moving locations, it's the same people who you've seen year after year after year.
Yep.
So I think that's going to provide some comfort to people. It's not totally new. It's just a new location. We are going to provide a new biopsy modality, I guess you could say, for those women that have to have breast biopsies. Currently, we do them in an upright position where the patient has to be upright so we can access it with a needle. And sometimes it's not always accessible that way, and so they may end up taking the patient to surgery to do it. We got a new piece of equipment that is known as a prone biopsy table, where you lay face down on the table and the radiologist can access your breast that way. So I think that's going to open up more.
Yeah, between the supine biopsy, prone biopsy, plus ultrasound biopsy, we should be able to do exactly what we need to do there. And with added staff and added physicians as well, our goal is to be able to do the one-stop shop, be able to get patients in as quickly as possible with no delay.
And are people referred to you from a primary care physician, or do they just come right to you, or both?
They can. Screening mammograms, they don't really need a referral, but we do have to have a doctor to send a report to. And then any follow-ups from that. If you're having problems, if you're having breast problems, you would need to go see your primary care or your OBGYN doc, and we would need a referral for that.
Can you talk a little bit more, if there's more to say, about how you've seen the technology change over your time doing this and what excites you the most now?
As everyone knows, mammography has gone from 2D to 3D. And even to get to 2D, that was a big jump too, but 3D. So now all of our machines are 3D. You don't have to have a 3D, but majority of the people do. Insurance, is now on board with 3D mammography where they didn't used to be. So that technology alone, 3D mammography, we're able to look at the breast in a totally different way. Lots of women have dense breasts. This helps with that. Ultrasound-wise, just the machines, the technology is so much better. Our technologists are very experienced. I actually have one technologist that is at the breast center all the time. She's registered in breast ultrasound, and we have a couple techs that are registered, and they're phenomenal. That's 90% of what they do, and having that experience does make a difference.
Not only was the design thoughtfully done on the inside of the hospital, but it has also been done on the outside of the hospital. So most patients will come to us off of Forest Road, and you'll enter into parking lot C, and there's a parking structure that is right there, and we're going to be conveniently located up on the 3rd floor. We have a beautiful suite. There's the 4 check-in desks to check in, a really pretty waiting room, private dressing rooms for all the modalities. And in the back of our suite will be staffed by breast surgeons, so that if you do need a breast surgeon, they will be there on certain days of the week. And then we can coordinate all of your visits and then to go see the breast surgeon. So you can do everything within one visit.
We will also continue to offer bone density exams at the new location. A lot of patients correlate their yearly mammogram with a bone density exam, and we will continue to have to offer that service. And our bone density, brand new, again, machine, does great things. And our bone density techs are certified as well.
MSU Healthcare at McLaren Greater Lansing has been in the works for approximately 3 years, and we've actually divided it up into 2 different phases. So phase 1 is the one that's going to go live with the Breast Imaging Center, and everything that is currently within our IDE building 6th floor women's imaging will be moving over to the new location. And our website, imagingservices.msu.edu, would have the latest information on all of that, with our change in our phone numbers. We're going to transfer calls, and all that's information can be found there. Phase 2, however, is where we're going to be moving some other modalities. Currently, everything will stay the same at MSU, at the MSU Clinical Center, and X-ray will be available on the IDE 4th and 5th floor. But in late summer of 2023, we're moving into a new building that's currently going to be built. It's under construction right now, but with it being winter, they've only moved dirt. But it's going to be on the south side of the hospital. We've been very involved in the construction and the design, working with the architects. We're extremely excited over that. And we will be moving general X-ray, ultrasound. We will have another DEXA machine there. CT, PET, and MRI will move there. So everything that is currently at the MSU Clinical Center in the summer of 2023 will move over, and we'll keep our website updated. And we will be alerting the community. We'll probably be back.
It's the MSU Healthcare at McLaren Greater Lansing Breast Imaging Center. And there's more information at imagingservices.msu.edu. I'm Russ White for MSU Today.
Find, rate, and subscribe to MSU Today with Russ White on Spotify, Apple Podcasts, and wherever you get your shows. And please share this conversation if you're so inclined.